Hey Kim.
Hello, doctor.
I see you are here regarding some painful menstruation. Did any other symptoms emerge during the period of your cramping, such as nausea, vomiting, headaches, diarrhea, or abnormal uterine bleeding?
Yes, I did experience cephalalgia, and I have been using more tampons than normal. I was also wondering if you could send my urine out to the lab for a urine test as I am having some dysuria.
Of course we can do that. How many tampons have you been using a day?
I would say maybe around 5 super tampons a day.
Wow, you're losing a lot of milliliters of blood per cycle. How long have you been experiencing these symptoms?
Would say around 6 months.
Were you diagnosed with any other underlying medical conditions in the past or medical disorders, such as major depression?
I have been diagnosed with depression.
Are you currently taking any medications for it?
The bottle of my RX says I take 50 milligrams of trazodone QHS.
Okay, I will be performing your exam now. That will include you laying in the lithotomy position as I insert a speculum and do a pelvic examination and a pap test. The pelvic exam will be me looking into your vaginal canal to your cervix. I will then use a swab to collect cells so the lab can give us your cytology results. I will then perform a breast exam to ensure there are no fibroadenomas, which are breast lumps. Do you have any questions?
I do not, and thank you for the explanation.
After your exam, my staff will give you a referral for radiology to get a bilateral mammogram, a DEXA scan to ensure that you do not have osteoporosis, and a colonoscopy to rule out any adenomas or colorectal tumors. Let's go. I will be beginning your exam now. Ma'am. You can check out with Kelly at the front desk and she will be the one giving you your referrals. Your results will be ready in about a week. We will be giving you a call if you have an abnormal result, but typically, no news is good news. You can also view your results in our patient portal, which is connected to our EHR system. Hey, thanks for meeting with me. I wanted to discuss a gynecology patient with you and get your input on how I should proceed.
Of course, how can I help you?
Patient X came in for her annual. She has NKDA and her HAMP. P shows no HX of previous issues and she hasn't had any SX. Her pap test came back ASCUS HPV positive, so I had her come back for a colposcopy where I collected a cervical biopsy. Her pathology came back benign, but when she came back, her CC was pelvic pain and dysmenorrhea.
I'm glad her pathology came back normal. I think the next best course of action would be to find out if she's having primary or secondary dysmenorrhea. A venipuncture and a menopause panel should be done to test her hormones for a chemical imbalance, as well as her CBC to make sure her red blood cell count is normal. If it's not a chemical imbalance, endometriosis could potentially be the leading cause, which would rule out primary dysmenorrhea.
If she has endometriosis, I could see if the patient meets requirements for a hysterectomy. However, if she's having a chemical imbalance, would the best thing to do be to give her a contraceptive?
Yes, I believe so. I would also get her consent signed for the hysterectomy and discuss a salpingectomy as well.
That sounds great. Thank you so much for your help.
Of course, let me know if you need anything else.
Have a good one.
Thank you, you too.